And we are live with episode 28 of the Wake Up podcast. And we're doing another Hall of Fame series here, which is me and two guests joining me. And on this one, we're actually got two Bitcoin doctors. We've got Dr. Bitcoin MD and Dr. BTC DCA. So we're going to be, we're calling one of them John and the other Tom. So let me just make sure I got this right. Tom is Dr. DCA BTC, or BTC DCA, sorry. And John is Dr. Bitcoin MD. So gentlemen, I won't introduce you. I will let you guys sort of introduce yourselves and maybe give the listeners a bit of just a rundown on your professional background. And then we'll sort of get stuck into this.
Tom,
Sure.
You want to go first?
Sure, I'd be happy to. So I'm a Bitcoiner. The reason I think I fell into this was because of the DCA stuff and the dollar cost averaging strategies. And really with Alex's Amber program, I think we meshed well, and I've enjoyed his podcast for a long time. And I'm a vascular surgeon by practice, by trade. I've been in this for about 15 years. And so, yes, I'm not a pulmonologist. I'm not a critical care physician or even a family practice doc. So I don't have an extensive experience with COVID patients. However, I have taken care of several now in the operating room who have been COVID positive from complications due to COVID. I've had family members who've had COVID. I've had colleagues with it. Nurses who are friends of mine have had it. And so I think I do bring some perspective to the table here for Alex in this discussion. So ask me anything you want.
Awesome. I appreciate that. Yeah. So I think just to give the listeners context, like, I mean, we'll talk a little bit about, COVID, viruses and all that sort of stuff. But, we're going to sort of broaden the conversation out to principles in medicine, how it relates to Bitcoin. We're going to talk about just general, a holistic view of health, versus, an isolated view and all this sort of stuff. So that's why I think both your guys' context and experience is going to be super important. But so thank you for that intro. And then let's throw it over to, now I can't remember, was it Tom or John that just went there?
It's Tom.
Help a brother out. Okay, so that was Tom. So John, let's throw it over to you, man. Give us a bit about your background, mate.
So firstly, I just want to thank you for having me on your show. I'm a big fan of your work. I've actually been listening to a lot of the Wake Up podcast recently. So I am a neurologist and a neuroscientist by trade. That's what I studied. And I also have been studying a lot of health data analytics lately in the last year or two. No relation to COVID stuff, although I have to say the timing was kind of perfect. So it has been overlapping a little bit with that. So I have some experience in terms of data analytics when it comes to COVID, but I wouldn't say I am an expert. I have seen and dealt with some patients, but as I'm not an expert in respiratory, it's not something that I specialize in. However, I have also had colleagues and both doctors and nurses who have dealt with it, and also family members. And I think this conversation should be interesting because I think most Bitcoiners have a different perspective on the world than any other group, really. They tend to be more independent, more libertarian, and very anti-authority in general. And when it comes to the events of the last year, particularly when it comes to medicine and public health, I think it would be interesting to hear what doctors who are maybe not in the mainstream have to say.
Man, I could not agree more. I think, one of the things for me that really, I guess, aligns to the core of my value set is how Bitcoiners share this sort of essence of personal responsibility, first and foremost. Like, I honestly think that you need to value basically your two core values need to be responsibility and freedom effectively in order to really appreciate, understand Bitcoin and quote unquote be a Bitcoiner. So I think, I'm really pumped for this to see how they overlap with with you guys, particularly having a background in medicine. So I could not agree more, man. So guys, I think where I want to start with this. So the first question I've got, and the way we'll do this is just a conversation. So whoever wants to pick up the question can run with it, and then anyone can chime in at any time. But basically, what got either of you into medicine in the first place in your particular fields? Curious to hear that.
So I would say it was mentorship, and I had a friend who was a family friend who was a cardiac surgeon, and he played tennis with my dad, and I played doubles with him one time, and he said, "Hey, do you want to come to the operating room and see what I do?" And that for me, as early as high school, just solidified what I wanted to do. I mean, I took one look at this person in the operating room, saw what he was doing, and thought, this is who I want to be someday. And just the ability to lead a team, have the outcomes that they did, and just that kind of mentorship and friendship, and then also working with medical students from residents is something that I'm big on. But just being able to really think for yourself, and the critical thinking that goes into being objective about what you're faced with every day and determining whether a patient actually needs surgery or not. That's something that only you can do after a lot of experience and training. And it's funny how a lot of this relates back to Bitcoin, in that you have to be a critical thinker. No one's going to hold your hand with this. Nobody's going to make sure that you have your private keys set and secure in a location. You're not going to mess it up. And surgery is the same way. You have to take the initiative and work with these people who, a lot of them are very little room for mistakes or any kind of screw up. So the margin for error is so small, and a lot of that could be said for Bitcoin too. I mean, you hear about Bitcoiners who they're adjusting their Trezor wallet after a few beers, and they screw it up, and then they lose it or something. It's for those of us who take it a little more seriously, it's hard to believe that can happen, but it's very common. So in a lot of ways.
How old were you when you sort of when that I guess fateful thing came around, the mentor that you mentioned?
Yeah, so I was 16 at the time, and so I determined I wanted to do it at that point and go eventually go to medical school. And I never was a great student growing up. I was never the kid who scored the best on standardized tests, and I really decided within college, my first year of college, that hey, I really have to be serious about this. I'm not going to hang out, at the frat house, every night drinking or anything like that. I'm going to go to the library. And so, I spent years, I mean, a lot of people probably look back at this and say, oh, you wasted the better part of your 20s and 30s, in libraries and hospitals. But on the other hand, I feel like it's something that I wanted to do, and it made a big difference on a lot of people and in myself and in my family. So it's a goal that was long-term and that I love, and I'd do it again. But I think to a lot of other people, they'd look at that and say, that's a total waste of your youth. And, I think there's different perspectives. But
yeah, well, I mean, everything has a cost, right? So like it's, whether you decide to quote unquote, waste your youth in that way, the cost of that is, you may not have, had the parties or, had fun with the chicks or whatever it might have been. So that was the cost to become who you ended up becoming in the medical field, the way you are. Whereas the cost of going out and partying and quote unquote not wasting your youth is the price you pay later on in life, which is is one of potential meaninglessness or or regret, which I think regret's probably the biggest cost of all. So and that comes, I think, when you haven't been conscious in your decisions along the way. So really interesting, man. What about you, John? What Tell us a little bit about your story, man.
So I think medicine is actually an extremely low time preference career choice. I think it's more of a vocation than a job or even a career. It's something that you end up dedicating a large chunk of your life to, especially the early formative years of your life when people around you are doing, all the fun stuff that Tom was talking about. And so you have to make a lot of sacrifices. I think for me,
Yep.
um, it went through stages, right? So I was interested in medicine at a very young age, and it was because of a couple personal family experiences. So, um, the first one, my father died when I was 8 years old, and
Oh
he
wow.
had an undiagnosed heart condition.
Mm.
And it was something that could have been preventable had he gotten the proper care and treatment. And I think I was always curious as a young kid trying to figure out, what went wrong, what could have changed, and all that. And I think from an early age, it was more of a curiosity, like a morbid curiosity, if you will. But then
Hmm.
as I got older, I became more interested in the science of medicine, the biology, and the physiology. And then when I was a teenager, my grandmother was diagnosed with Alzheimer's. And that to me was a shocking experience because
Mm.
it's amazing to see someone who you've known your whole life just not be able to recognize you at all.
Mm.
And I didn't know how to deal with that. And I wanted to learn so much more. So that, I mean, that got me really interested in the human brain and neuroscience, and that's what I ended up majoring in, and that's what I ended up studying. And I ended up doing some Alzheimer's research as well in a biochemistry lab. Um, and so my interest changed slightly over time, but I think because it's such a long journey, that's not terribly surprising. I think most people who go into medicine and stick with medicine end up maybe slightly altering their interests over time as you learn more, as you change, as you grow older. And I think that's just a natural course because so much of your life changes and so you change a lot, especially in those teenage and early 20 years when you're still learning about yourself and about the world.
Very much so. Yeah, dude, Alzheimer's is such an interesting thing. So it's like, you know, I've always been interested in this idea of how, life is sort of this culmination of memories. And, Alzheimer's, like, for me, I think is one of the most tragic, uh, call it, diseases or, perversions of the mind, in the sense
Mhm.
that, the very nature of, the culmination of the experiences and memories you've had in your life begin to evaporate. That shit's
Mhm.
fucking crazy, man. Like,
And what's really difficult is that it's most traumatizing for the family members, really,
mm, mm, mm,
because for the patients themselves, they tend to not be aware of their own condition most of the time.
mm.
And when it comes to family, they are absolutely devastated because they just can't fathom that this family member that they've known for their entire lives all of a sudden doesn't recognize them, doesn't know their name, can't remember, very important events in their lives. So it's just amazing that you can have all these moments and experiences and they can just be taken away from you, even though you can still be present in the physical state.
Yeah, and
Yeah, that's
there's certainly an epidemic of it too. I mean,
Mm-hmm.
if you talk to police officers, they'll tell you that a lot of their calls are for going into a house or maybe trying to track down somebody who has Alzheimer's who left the house or left the facility, and they're having to make all these phone calls and do all this social work that frankly you wouldn't think a police officer would have to do, but it's a problem in the inner city apparently.
And it's also a growing problem because of the shape of the population, right? So we're having a, a population that's growing older in age, especially in certain countries like, say, Japan or the US, where we're having a very large older population, but the younger generations aren't having as many kids. So you're just having these populations of older people who are living longer than they have ever lived because of the wonderful advancements of medicine and society, but there aren't enough people to take care of them. And now we're having increased cases of Alzheimer's and all types of metabolic disorders as well. And it's just it's it's a blessing and a curse, right, to be able to give people more time on this earth, but you have to consider quality of life, and that's one of the biggest things when you discuss end of life care. It's the quality of life in addition to the amount of time that you give people as well.
Yeah, I mean,
and so
I think bringing up that point of how do you care for these people, that's why a lot of these skilled nursing facilities are so overloaded with work. I mean, they for one, they don't have enough employees, and nowadays both spouses have to work to make an income to pay for their mortgage and pay for all the child care expenses. And so when their parent gets Alzheimer's, they can't afford to put them in a nursing home. So oftentimes they live in their home too. So the parents are taking care of not only their parents, but the kids. So now you have these big nuclear families living in, sometimes a 1 or 2 bedroom apartment. So it's no surprise why, if you have a viral respiratory illness, that's going to run rampant through those types of communities. And I think COVID is exposing a lot of that as well.
Mm-hmm. I mean, we saw early on. Sorry, Alex. We saw early on some of the most prevalent areas for COVID were Italy and Spain. And one of the biggest reasons why is you have these multi-generational households all living together, on top of the fact that you have high rates of smoking and high rates of obesity. It's just a killer combination.
I wanted to ask something about Alzheimer's beforehand. So like, I could not agree more with your sentiment about quality of life is sort of the most important thing to focus on, because I think part of the derangement syndrome in society these days is we live in a world that incentivizes consumption, incentivizes just this blind chase for yield, this this idea of more, and this ridiculous notion that we should somehow just live longer just for the sake of living. Like, we vilified death and pain. Like, we vilified the notions of death and pain so much that we've forgotten that they're actually natural parts of the cycle of life. And people are fucking deathly afraid of moving on. And I think one of the sad effects of that has been, like, for the first time, I think, in history, to a major degree, the older generation is like asking the younger generation to sacrifice for them. And I think that's one of the perversions of this incessant need to live longer at the expense of the actual quality of life that we're currently experiencing. Like, I was seeing a tweet from some old person, which I always point to, and it's like this old person saying, oh, like, I never get into a lift anymore. I don't jump into like they've sort of like shut themselves off from all these things, and basically living in a fucking basement. And for what? Just to continue living? Like, is that really what we're here for? But anyway, like, I don't know if you got any comments on that, but I want to sort of ask. I don't know why I went on that rant, but I want to ask something about Alzheimer's.
Can I just add something there? Can I just
add
something?
For sure. So
please. This is just a personal experience. So, I had a chance to sit down and speak with my grandfather about everything, and I implore you, if you have any living older relatives, this is a great time to sit down and talk to them, because they're going to have some incredible perspective about everything that's going on. And one of the things that he said that stuck with me is he just blatantly said, I'd rather have 6 months of enjoying my family, going to dinners, celebrating birthdays, celebrating graduations, doing all the things that make life worth it, than 2 years sitting alone in my room being miserable.
Mm-hmm.
Just kill
Mm-hmm.
me. He said, just kill me if that's the case, honestly.
Mm-hmm.
And you know
Mm-hmm.
what? I felt for him, because especially when you're at that age, your joy in life is your family. Your joy in life
Yeah.
is their achievements, their joys. You live through
Yep.
them.
Yep.
And so when you take that away from people, it's torture. You're torturing them.
It is exactly torture. That's what I was picturing in my mind. Then it's like sort of it's like getting someone, and like what they used to do in the medieval times, which I'm sure they also do somewhere these days, is like you beat the shit out of someone, you torture them, but then you get the doctor in to keep them alive, just so you can torture them some more. And that's effectively what the state is doing to people at the moment, is they're forcing them to live in a state of perpetual fear, depression, anxiety, just so they can continue living in more fear, depression, and anxiety. It's fucking backwards. And
Yeah, I mean
I'd
that's
like,
there was that media story where they tried to vilify all the old ladies who went to the illegal karaoke bar thing. I think it was in California. They said, how dare you go to this thing and do your karaoke? I mean, and these women were saying, look, we may not have another day on this earth. We're
yeah,
gonna have
yeah,
we're gonna have a good time whether you like it or not. And they
yeah.
kept breaking out of this. I think it was a nursing home to go to this illegal karaoke thing, and the MSNBC and CNN wouldn't let it go. They,
Morons. It's
they
like, how
literally
dare
wanted to,
they?
they literally wanted to handcuff them all to a bed.
It's fucking disgusting, man. It's absolutely disgusting. All right. Before I get worked up here, the question that I wanted to ask about Alzheimer's was, would it be a fair statement to say that is more prevalent in society than it has, like more prevalent in society today than it has been in the past? And would that be potentially related to things like diet, things like the increased stress load, of the life we live today, which is this basic perpetual race to consume and race to fucking work just to have more month at the end of the money? You know what I mean? Like, is that sort of, is there a correlation or potential causational link there between the kind of lives we're living in modernity today? Like, tell me your comments on that. I'm keen to hear about that.
So I think there's no real question about the total amount of cases of Alzheimer's. And I think that's generally due to population structure. As I said earlier, we have much more
Mm-hmm.
older people
Mm-hmm.
than we've ever had compared to younger people living much longer, and it's natural for people to develop these conditions at a later age. What's really interesting is the potential link between people's metabolic state and their
Mm-hmm.
mental state. And this is a fairly recent point of contention and point of study. I'd say in the last 5 to 10 years, we're learning a lot more between the links of, say, diet and mental state in later life. And, it's a shame that it's not something that's more front and center, because
Mm-hmm.
what really troubles me is, when you're dealing with patients in the morning, and then you walk by around lunchtime and you see the meals that they're giving out to these patients,
Mm-hmm.
and those meals aren't fit for prisoners.
Hey, but they're the heart healthy diet. The dietitian said they
Yeah,
said, it's
it's
supposed to work.
fiat food for the fiat brain. That's what it
Yeah.
is. And you know I think unfortunately all that stuff ends up going underground in terms of the discussions between metabolism and mental health, metabolism and physical health. And I'm sure, Tom can attest to this, but something like as, rudimentary as basic nutrition is not a topic that's covered very well in medical school, if at all.
No. That's been my own study and research that I've come to the conclusion that the modern, American diet plan is a complete fraud. It needs to be turned upside down. If you go on rounds and someone's put the patient on a heart healthy diet, and you see that they have Pepsi, Mountain Dew, they have a piece of chocolate cake, they got 2 humongous pieces of bread, and some mystery meat. It's probably some plant-based thing. And then you look at, say, their protein booster, their Ensure, and you turn it around and you look at the ingredients. Did you know that this stuff has high fructose corn syrup in it? And by the way, high fructose corn syrup inactivates vitamin D in your body. So why are we giving all these elderly protein deficient people Ensure for protein boosting things when that's further inactivating their vitamin D? We know now that anybody who's deficient in vitamin D is susceptible and to a severe COVID reaction. If you can just eliminate all that high fructose corn syrup, the sugar, and all of that nonsense, and check people's vitamin D and supplement it, the chances that you're going to get a severe COVID infection drop dramatically. The chances you're going to be hospitalized drop dramatically, and certainly not on a ventilator. So I think that has all been lost in this conversation about lockdowns and masks. No one's willing to talk about these very basic things. And I think the reason is monetary. It's economic. It would affect their bottom line of, Warren Buffett's, I think he owns Pepsi, and, he wants, you drink your high fructose corn syrup all day long, have 6 to 7 meals a day.
I also think it's interesting to expand this conversation out to medicine in general, and how medicine, the way it's taught in medical school and training, you're taught to treat disease rather than to maintain health. And I think that general perspective actually really disillusioned me for a couple of years in medical school. I was kind of very disappointed that we weren't discussing things that could actually help people maintain a healthy life and, give themselves a chance at being healthy for the longest period of time, and, like we were saying earlier, increase their quality of life. Instead, you kind of focus on what to do when you're presented with the disease rather than how to prevent the disease. And that could really affect the way you approach patients. I've seen so many doctors in my life just approach patients as a bed number. So bed number 6 has this disease, and they'll be known as whatever disease they have. They won't have a name. They'll just have a bed number and a disease. And I can guarantee you Tom has had similar experiences with colleagues that say bed number 6, the one with diabetes, or bed number 5, the one with, some respiratory illness. And it dehumanizes people, and you tend to just lose touch with that human side of medicine and care.
Yeah, I think, in that same vein is that, electronic medical records have only exacerbated that problem, because we're all forced to see more patients than we were seeing before. It all comes down to the medical record, and it's just a big cash register, bill for this code, bill for that code. And, they've taken, I agree, some of the humanity out of medicine with the computer. And it's sad because it could be much better. And I think technology will fix this. This is just another thing that over time will be improved, and there will be an evolution of the process. But right now, it is all focused on the billing and the coding to make sure that they're getting their level 4 and 5 notes or whatever it is, so that they're billing the insurance company the maximum amount for each patient.
Just to build on that point, John Hopkins study suggested that residents actually spend only 12% of their times with patients. They
Oh yeah,
spend they spend a majority of their time behind a computer.
it
And honestly, in my experience, 12% actually sounds kind of high.
it's high. I mean, I go on rounds and the nurses are on the computer more than they're with the patient.
Mm-hmm.
They're at the nursing station punching in all of the information they have to for their shift. And many times they have to stay late because they didn't get all the charting done on the computer. So yeah, that's an enormous problem. I think that if there's anybody listening who can program and do this type of thing, I think there's a huge opportunity here to fix this and to streamline this process for all healthcare professionals so that the experience is better for the patients and the physicians who are actually doing the physical exam for a longer period of time. I mean, I can tell you story after story of things that were sent to me after they had seen 5 other people, and basic physical examination was not even done. And I think it all culminated recently when I went to the doctor for the first time in 3 years, just for a regular checkup, and the doctor didn't even examine me. And I walked out and I thought, wait a minute, are they going to bill me for a physical exam? And they didn't even listen to my heart. They didn't listen to my lungs or anything. And that was frustrating. So, because it's one thing that I try to spend a lot of time with my patients, and then of course it sacrifices my own life, and that afterwards and after a day in the office, I have to go back to the EMR and start clicking and making sure it's all done. But some are able to do it much faster than I am while the patient's in the room. But then I feel like I'm not paying as much attention to the patient. And anybody who's been to a physician in the last year, 5 years, can tell you that the doc's usually looking at the computer rather than them.
Absolutely.
There's a bunch of threads that I want to pull on. One of them, I mean, the dehumanizing element is a huge one, obviously, and I think that's just the real. There's a piece that I want to go into about like how fiat mandated, I guess, public health. Really, public health is fiat health, right? Like it's center managed, top down, and it kind of, it's a perverted solution for a perverted problem. But before I get into that, I want to set the foundation of this. What John mentioned about like the focus on fixing the problem instead of preventing it in the first place. Which I always discuss. I talk about it as symptomatic thinking versus causal thinking, and everywhere I sort of look at in life. So I've done quite a bit of study on like the psychology, neurolinguistics, and just sort of more. So not the neuroscience side of things, but more the language of the mind, and how that relates to how we find meaning in life, how we behave, and things like that. So I think I would say a couple of my greatest heroes in that sense were Viktor Frankl and Alfred Adler, who really, like, Alfred Adler was a contemporary of Freud. Not many people know his name because his method of viewing psychology is not very profitable. He does away with even the idea of fucking trauma. Like, he does away with a lot of things. So people sort of view it as radical in today's day and age, because he doesn't recognize the need for a lot of the what the drug companies sort of peddle these days is, your depression is apparently a lack of Xanax, or sorry, a lack of Prozac, as opposed to a problem with your own perception of meaning in your life, which is more likely the reality. But this epidemic of symptomatic thinking versus causal thinking, I think, is so prevalent across so many things today. It's not just medicine, in the human body and health, but it's how people, are constantly playing fucking oppression Olympics. I'm the victim of this, and I'm more oppressed than you, and I've got more, like, instead of taking responsibility for shit and finding, and placing themselves at cause, we just fucking play this perpetual blame game and just pass it on to something else. It's like we're playing a fucking game of hot potato. It's the same with the monetary system. It's the same with how we manage our finances. You know, like all of our money gets taken from us like mandatorily through bullshit 401ks and IRAs and, you know, Australia superannuation funds. Like, and our 10% to 20% of our money goes into public markets for shit that we wouldn't normally invest in. Like, why the fuck is 10% of my money going into BHP or Rio or Apple or fucking some company that I have no affinity to? But, you know, it's again, and we wonder why, oh, you know, the tech giants are so big. Like, that is a symptom of the cause, which everyone is too lazy to want to take some time to dig into. So I think that piece there is really important. I kind of wanted to say that and just see what you guys have as some feedback around the, you know, just the problem around, I guess, in the health space, building immunity versus, you know, healing sickness or healing disease.
Sure. I mean, I think that's one of the reasons I wanted to do surgery. I think I was just impatient on a lot of the internal medicine rotations and family practice. Whereas in surgery, I felt like I was actually curing something. But what I came to understand is that, yes, you will have some immediate gratification, but that patient is yours for life, and you will continue to follow them up for many, many years to come. And that goes also with the addiction thing. I mean, with tobacco, I mean, that's the number one cause of peripheral arterial disease, carotid artery disease, aneurysms in the chest and abdomen. And, you know, I have tons of patients that I've performed these operations on, and they still smoke. And that's something that I struggle with, is trying to convince them to smoke. And that's the whole addiction psychology is, you know, the chances that you're going to get somebody who's 80 years old to quit smoking if they've been smoking since they were 20 is probably zero. So, right. So, you know, we ask that they stop, we try our best, but ultimately it's up to them. And that's where the self-reliance and really being able to think for yourself as even a patient is so helpful. But it's sad to see that I think over time, since I've been a physician, I've seen less and less where people are able to do it on their own. They're more willing to, say, take a pill to try to quit smoking. That's the number one thing is, oh, well, can't you prescribe the Chantix for me? Won't that work? And I think, you know, and then when I explain some of the economics to them, you know, if I could just go off on this tangent for a bit, you know, I was on a plane, I think it was 2007, going to a conference, and there was a Business Week article all about Philip Morris and how brilliant they were for moving their headquarters from Houston to Switzerland. And it was also talking about what a great move it was to avoid US lawsuits for future medical payouts. And they knew that eventually the US healthcare system was going to come to a crossroads. We'd have unsustainable debt, and that we'd be looking for someone to blame. And the tobacco companies would be the first ones, right? So they had to leave the US. They changed their name from Philip Morris to Altria, and their CEO was widely celebrated for doing all this. But the thing that really got to me is he said, yes, and now that we're in Switzerland, we can start to double down on our marketing to the developing world, the Middle East, Africa, South America.
Let's go fuck Russia. Everyone else up.
Right, exactly. And that was in the article, the author of this thing in Business Week was talking about how great this is and how good it's going to be for the stock price and the valuations and the dividends. And, you know, if you look at the price, a lot of these tobacco companies stocks, they don't go high, but you know what they do get? They do get a great dividend. And the reason they pay such a high dividend is because they can't keep any cash on hand, because they know eventually this whole thing's, these other governments are going to get really pissed off and say, look, you know, all these hospitals and all these people in your hospitals, 75% of them are there because of tobacco related illnesses. So because of that, they pay an enormous dividend. And you know, I learned a lot of that from the Business Week article that I read, but it stayed with me because it just illustrated how sick our fiat society is that, you know, they're willing to make these people heroes who are essentially getting kids addicted to a product that's likely going to lead to the loss of their limbs at some point. You know, bladder cancer, lung cancer, heart disease, strokes, it's just unconscionable that this
Well,
is, you know,
I
something
would.
that we celebrate as a whole. I'm not saying stop tobacco companies altogether, because, you know, in my heart, I'm a libertarian, and if you want to smoke, go smoke. That's your choice. Just know that you're going to need me eventually to fix your arteries.
Here's the thing though. This is why I think like it's not the tobacco companies themselves that are a problem. I actually would like to pinpoint two things here. I actually think the public health edifice is actually the problem, because what it does, and me and Francis were on a call actually the other day. I got to release this podcast. We sort of discussed how public health is probably, other than maybe public schooling. So we know that this idea of a monopoly on money fucks everything, but through the monopoly on money, I think two of the most disastrous institutions in existence today are public health and public schooling. And the reason public health is so bad is what it does is it removes a large degree of responsibility from the individual, because the state will apparently take fucking care of you. And that insinuation or that load of shit basically means that me as an individual, I don't have to think about the decisions I'm making. I can just be a dumb cunt. I can go and smoke. I can, take stupid risks. I can eat like a fat piece of shit. I can do all this dumb stuff because the state is going to come and, take care of me through some sort of ridiculous public health system, which is, broken at the best of times. So I actually think one of the perverse ramifications is the fact that the consequences of making bad decisions are socialized as opposed to us paying for the consequences at an individual level. Now, would that eliminate smoking from the planet? No, it would not. But it would encourage people to think twice when they know that there is a consequence for their actions. Number one. Number two, the other thing I'd like to add there is a lot of these companies, like I don't know how much a government would actually push back against these smoking companies for the very reason, like, yes, there is a lot of lobby groups and all that sort of stuff, because it's quite hard for them to sell a narrative that says, oh yeah, smoking is good for you, doesn't actually impact you, when the reality of the effect is so like present and in our face. So they can't do that. But the fact that the public, the money printer, the way it works is that the closer you get to the monetary spigot, the more capacity you have to benefit disproportionately and thus maintain a business that would otherwise not be as strong. So these companies that are already public, they're already some sort of oligopoly and monopoly. Most of the the tobacco companies are, you can basically draw a line back to a couple of them. They're close enough to the monopoly that is the state, through both the printing of money and the monopoly on legislation, to stay in business when arguably, as more people become more health conscious, less and less of their raison d'etre would be in existence. So I think their existence is perpetuated through this fiat Ponzi scheme that we live in, A, and B, the sort of the advertising probably is also another issue. So these situations
I
aren't
think
as straightforward. Like they're all interconnected. They're quite complex. But I just think that public health and the money printer go burr is one of the reasons why these companies still subsist and persist and are able to maintain operation to the degree that they can today. When I would argue that they.
a perfect example of that is Pfizer. You know, if you think
Oh,
about
thank you.
what they've done with this vaccine is that, this vaccine is going to be free, at least here in the United States, to just about everybody. But the actual cost, it's $40 a shot, right? So that's $80
So
for me.
what's yeah?
That's 80. That's 80 times. Let's say they vaccinate. Let's say the Pfizer vaccine goes to 150 million people. What is that? 150 million times 80. Well, that's what goes directly from the Fed, from the government, to Pfizer. So that's a monopoly. There's no competition there except for maybe Moderna. So Moderna is going to be priced in a similar fashion, but nobody has to pay for that, right? So then the public health is going to roll it out. Well, here's the problem with that. They're saying now in my home state that all the homeless people and the prisoners get it first, but yet my parents who are in their 70s can't get it, yet they've worked their entire life, paid into the system, and they're walking around with N95s on. And then my wife's mom, who's still alive, she's in her 90s, locked up like a prisoner in her house, and thinking, great, I'm not going to get a vaccine for 6 months because they got to vaccinate all the homeless people in my neighborhood. And which, by the way, the problem with vaccinating all the homeless is that many of them, their brains don't work right, so they're not going to know when the second shot is supposed to go, or they don't have a phone, or how do you? It's an enormous logistical problem. Now, I'm not saying don't vaccinate the homeless or the prisoners. I'm saying, yes, that has to be done. But I think there's a better way to do it than what the current public health people have done. And that goes back to what you're saying, Alex, about the problems with public health and the problem of being so close to the money spigot. And that's the entire problem, is that it allows the people, it prevents the people who've been paying into this type of system their entire lives to receive absolutely no benefit. You guys got to wait in line, right?
The thing is like, beyond anything else, like, there's all sorts of talk about the vaccine. Like, me personally, I wouldn't, the last vaccine in the world I would ever take is this one, purely because of the time frame it's been pushed out at, and particularly for something that I already had COVID. It wasn't that severe for me. I've got a very strong immune system. I've really looked after my health for many years. And, like, why the fuck would I want this in the first place? But I think just for me, what pisses me off the most is just the fact of how much of a scam it is that a central institution like a government can mandate something for people, and they may not overtly mandate it. They might just say, okay, well, we're not mandating it, but hey, you can't get on a plane, you can't go here, you can't do this, you can't take a shit, you can't wipe your ass, you can't go outside, you can't go in a shop without the vaccine. But hey, it's not mandatory. So first of all, like, the fact that some central institution could do that, but then say it's free, but then steal that money through theft and inflation from the fucking rest of us to fund that, so that a couple fucking corrupt pharma companies can get rich for something that people should be voluntarily wanting to do it or not. But we're going to be forced through fucking panic, fear, and some sort of limitation on natural liberties to take something that, by and large, 95 fucking percent of people on the planet do not need. So I don't know if you got any comments on that. So I'm quite like,
I think
that shit enrages me.
There's a book I read last year called Code Blue, and it's all about inside America's medical industrial complex by this guy named Mike McGee. And I was struck by, everybody talks about how the military industrial complex is what most people think is the number one benefit from the federal printing and all that, but it's actually the pharmaceutical industry and the medical industrial complex of all these companies like Pfizer. They have more lobbyists than even Bechtel and Halliburton and all those guys, all the war people. That was staggering to me, and it's been going on for years, especially since the Nixon administration. After 1971, the money printer just started going burr, and it was one scandal after another throughout this book, showing how Pfizer has essentially gamed the system for multiple different medications throughout its time. And I think the vaccine is the latest. Now, having said that, I think I disagree with you a little bit on the vaccine. I mean, for me, I didn't get COVID. I oftentimes wonder what would happen had I got it, how fast I would have bounced back. I mean, one of my partners bounced back in about 48 hours, and it wasn't a big deal. I was offered the vaccine, I took it, I had both doses, and I'm fine, right? But long-term benefit, effects of it, who knows? Now what you said makes a lot of sense, is that you had COVID and now you built up a natural immunity. So, is that going to be better than the vaccine? I think you could make an argument for that. Now, I'm not an immunologist, but I think there certainly would be something to be said for that. And how long does it last? I don't know.
Yeah, I mean, we'll dig into the vaccine a little bit later because there's some questions I want to ask about, like, from some of the reading I've done, from what I understand, it's not actually a vaccine that immunizes you from it, but it's supposed to do something else, like to help you cope with it or something.
You can still get it, but the chances that you end up on a ventilator and getting a severe case are very, very small. Only about 4 or 5% or something.
So does that even then qualify, like technically speaking, as a vaccine, or is it not really a vaccine at this point?
No, sure, it is. It is. I mean, it's an mRNA vaccine, and at least the New England Journal study that I read shows that it's 95% effective after about 7 days after your second dose of preventing a severe case of COVID, and that certainly makes sense to me. I mean, look, I've had friends who have gotten pretty sick from this. There's been some people that I follow that have gotten pretty sick from this, and even very young. So I think it depends about, what type of metabolic health you had beforehand. I think there's so many factors, are you diabetic? Are you overweight? But I think that, as we move forward, I mean, my own opinion is I think the vaccine is a good idea overall for everyone. It's just logistically, how do we roll it out? I don't know.
Yeah, I don't know, man. I think this is a slippery slope towards like what happens when the next, like, we've been living symbiotically with viruses for fucking tens of thousands of years. And, I think we continually trying to, basically sanitize everything around us. Like, and we're basically separating ourselves from, the natural ergodicity and dynamic nature of life. I personally would just rather take my fucking chances. I mean, when I think about the fucking sludge, slime, and unhygiene that we grew out of 200 years ago. I mean, we used to wipe our ass with one hand and eat with the fucking other. For thousands of years, like we didn't have basic hygiene, and we survived and got through all of that shit. And these days, we're afraid to fucking walk outside, or we're afraid from respiratory diseases because like we are so sick, unhealthy, obese, depressed, immunocompromised, and going down the path in my mind of, again, I think vaccines are symptomatic. They come after the fact instead of doing, having some sort of push for people to build their fucking natural immunity and get healthy. That is a far better solution. I think it's a natural, emergent, bottom-up solution as opposed to this sort of top-down mandated, let's fucking fix something. And again, when we fuck with complex systems, we think we may have fixed one problem, but we don't know how many other problems we've created down the track. And that's sort of my biggest concern with.
Well, you make a great point, especially, there's that meme of the morbidly obese lady in the wheelchair who's only 40 years old, and she's wearing a mask, yelling at the person without the mask to put one on. I mean, I think that is a problem, is that and that speaks volumes to the fact that, we're not looking at metabolic health. We're relying on these crutches like a mask to say that that's going to protect you for the long term. Well, look, you may get through COVID with your mask, but you're gonna have diabetes, and you have an amputation of your entire foot in the next 6 months. If you're going to continue, your lifestyle of drinking all these sugar drinks and high processed foods and all this. So I think you make a great point in that regard.
Alex, do you mind if I chime in with a couple thoughts?
Please.
So I just want to talk about some topics in general and then relate it back to some of the things you guys just talked about. So the things I wanted to bring up were incentives, trade-offs, autonomy, and meaning. And I think you guys touch on some important topics, but I'd just like to expand on them a little bit.
Please.
So with regards to incentives, I think what Bitcoiners understand that most other people don't is that the incentives of society can be traced all the way back to the type of money it uses and the monetary network that it functions on. And I think that's one of the biggest reasons why a meme like Bitcoin fixes this is so popular and is so applicable to so many different topics. It's because the problem is so deep rooted that you need to go straight to the core if you want to fix it. Anything else will just be papering over the cracks. It's not going to actually solve the problem. So when it comes to something like incentives, when you have governments able to control the money supply, print however much they want, whenever they want, with no input or auditability from anyone else, what you have is price signals that are completely dissociated from reality. And one of the problems that happens is inefficient capital allocation. And the other problem that happens is inefficient government programs. Because there's no check and balance on these government programs, there is no consequence for running an inefficient program, whether it's the post office or the healthcare system. And so what happens is you just have years, decades of completely inefficient programs, and they just run into perpetuity with no check, no balance, nothing. No one can audit any of this. No one can actually make any changes, and no one can compete with it because they're so large that anyone that tries to compete with it just gets absolutely demolished. And medical care, healthcare is one of the greatest examples. So the US is very unique in terms of its problems in terms of healthcare. I think the US is it's honestly the worst of both worlds when it comes to socialized medicine and free market medicine because it's neither.
So true. It's like this deranged in between.
Yeah, it's a Frankenstein monster, but the problem is you get none of the benefits of either. You don't get
Mhm.
the central planning and coordination, or supposed coordination, and you also don't get the free market competition. So if you want an X-ray in the United States or a CT scan or a blood test, you essentially have no idea how much it's going to cost. You go in, you hopefully have insurance, which is another problem, and you hope that your insurance covers some, most, or all of it, right? But you don't know how much it's going to cost. And so you have it's such a mess. So the way insurance companies work in the US talk about incentives is it's essentially tied to your employer. So if you don't have a job or if you lose your job, the odds are you're also losing your health insurance. So if you want to talk about perverse incentives, that's a major one. There are so many people I know that are afraid of losing their job, or they decide not to pursue other careers or other jobs or other opportunities because they don't want to lose that health insurance.
Mm,
And
mm,
think about the implications of that on someone's future. You have people stuck in these slave wage jobs that can't leave because they know that not only will they lose their job, but they'll lose their insurance if they choose to leave. And then you have, the drug companies that are also playing this game where they don't have transparent pricing. You have no idea what you're paying. Insurance companies can charge what they want, drug companies can charge what they want, and you have these behemoth, hospital administrators, this bureaucracy of medicine that completely dissociates the doctors from the patients. So if you want to talk about middlemen and um, you know, the bureaucracy. Medicine is a great example. There's a chart that I always love sharing on Twitter. It shows the number of doctors versus the number of administrators in medicine in the United States. And I think the number of doctors are about the same, maybe slightly higher. And that's partly due to the restraints put on by the, you know, American Medical Association, and the number of seats available in medical schools every year. And, you know, that licensing issue, that's a whole other issue in terms of free markets, and something Ron Paul always talked about. But the bigger issue is when you look at the administration and you see increases of several thousand% in terms of the number of administrators. And what's shocking to me is people look at that.
Waste. Yeah.
People look at that and they think, you know what? We need more. We need more socialized medicine. We need more government involvement. And that drives me crazy.
I think I want to touch on one thing there.
Well, that's exact. Oh, go ahead, Alex.
Yeah. So I was just going to say the idea of like drug companies and things like that being able to charge whatever they want, that I actually don't have a problem there. Any company should be able to charge whatever they want. The problem is because of the natural tendency towards monopolies. So when a monopoly on money and a monopoly on legislation exists, i.e. the central bank and the government, you actually create the perversion of oligopolies around it, you know, based on who was in the early days innovative or quick enough to get to get large. And then what they do is they end up building a moat, not of innovation and competition, but they end up building a regulatory moat, and they stay in place. And then what happens is they actually they eliminate the ability for a competitor to come in to actually drive the price of medicine down naturally. So it's like if you have a fucking restaurant and you have the only license to have a sushi restaurant in your town, you can charge whatever the fuck you want, and you can gouge people because, you know, nobody else can come and open a sushi restaurant to come and compete with you. So I think, you know, I again don't have a problem with private companies charging anything, but the way the system is set up, it's so fucking broken that competition can't naturally emerge to drive the prices of these, you know, goods and services down. Not to mention the fact that half of this shit wouldn't even be needed anyway. Would we not have such a fucking disastrous fiat food and nutrition system? But anyway, that's another entire conversation. So I just wanted to pull on that thread there and clarify, because I think that's just a really important distinction. Is
no, I think that's a good. Yeah. That's a good distinction you make. I think we're all in agreement there. I mean, I think we all believe in the same principles of free markets and competition. The problem is, like you said, this isn't really a free market, and there is no competition. It's just a bureaucracy-driven monopoly, and that's what happens when you have perverse incentives, and it all starts from the money. And so go ahead, Tom.
Yeah. So John, if you remember in medical school, I don't know which years you were in, but like I was, you know, 99, 2003 in med school. And I remember distinctly people saying, oh yeah, pain is a vital sign. You need to record from 1 to 10 how severe this patient's pain is. And, you know, looking back on all of that was funded by drug companies, all of that CME, all of that education that they were bringing into medical schools all over the United States was financed by Purdue Pharmaceuticals. That is the company that got our country hooked on narcotics, on Vicodin, Percocet, Oxy. So all of these people were given all these narcotics, these oral pain meds, like vitamins, for years from surgeons, from family docs. And then you had problems with some docs just setting up these pill mills at hotels and charging people, you know, $50, $500, all this money for as many prescriptions as they wanted. So they're all addicted. They're all basically heroin addicts. So then when they lose their job, where do they go? Well, they go to the local drug dealer. And that's why our heroin addiction problem is so high in this country. And it's directly related to Purdue Pharmaceuticals. But, you know, they had this pipeline and access to all these medical schools where they essentially paid off whatever physician in those medical schools or the dean to get in the door, to brainwash a lot of the young doctors to think that pain is an actual vital sign. And that all went away immediately. I mean, now, everywhere you work, you got to take these online modules. Oh, don't give anyone over 7 pills of whatever narcotic, even if severe pain, and only if in a hospice type situation or advanced metastatic cancer. So you go through all these modules now to do this, but before it was just handed out like candy. And I think this all came full circle for me. About a year ago, I was in New York at a conference and walking through the Natural History Museum, and there's a part of that museum where they have these Egyptian hieroglyphics and massive tombs that they brought all the way from Egypt to New York City. And you know who funded that? That was all that family. The Sackler family paid, what is it, billions? I don't even know how much money it would take to bring these artifacts back, to donate to that Natural History Museum. And that just shows you how connected the big money is to these pipelines. They basically had carte blanche at every medical school to pump their propaganda to sell their medications. And you wonder how many other medications have been brought to market the same way. Mm-hmm. It's just, I think Purdue and the Sackler family just typified just the incredible corruption in this top-down type system that we currently have. And in the same line of thinking, if you look at there was a book last year called The Price We Pay by this guy, Marty McCary, out of Johns Hopkins. And he was investigating why personal bankruptcy, the number one reason for bankruptcy in the United States right now, is medical bills and unpaid medical bills. And the reason is because a lot of hospitals will frankly put you into collections. They'll hire people to come after you. There was one town in New Mexico where 70% of the people who lived there had an outstanding collections bill from the local hospital. So he went to investigate with his team. They went into the local courthouse and they found out that the judge in that town actually is on the list and has a collections agent after her. So it's just, that's a situation and a system that cannot possibly sustain itself through the long term. You look at inflated costs and inflation, and healthcare costs are the number one. And that's the reason why so many people in this country are bankrupt, at least. Now, I'd love to hear from Alex. You ever hear of anybody going bankrupt in Australia due to medical bills? I would imagine not, right?
I got myself muted, sorry. So look, the Australian system is a little bit different. So I think to John's point earlier, the US is unique because it's this clusterfuck of private. There's Frankenstein between private and public, which is all completely broken. Australia is far more on the public side, and they've done a good job of getting out of the way of the private. So there is some really good private hospitals, and they are actually fundamentally far more private. Now, the other thing as well about Australia is that it doesn't have the large scale pharmaceutical fucking behemoths domiciled there. Like there's a couple things, but it's nowhere near the lobbying power of the US. So I think Australia is a bit unique in that sense because you don't have the most of, like, we all get basically taxed, I think 3 or 4% of our money towards what's called Medicare, and then that basically gives you basic coverage of most things. But again, like all of these sorts of, I would much rather, me personally, I would prefer to just buy private health insurance myself and use it, like set up a custom insurance thing and use it as and when I need it, as opposed to having 4% of all of my money taken for public health, which, mind you, I never, ever, ever, ever use. I think the last time I went to a doctor was maybe 12, 13, 14 years ago. Like I haven't been to a doctor since then because I'm quite healthy. I look after myself. But the amount of money that has been taken from me through taxes throughout that time has been, well in the hundreds of thousands of dollars. And that's all gone to pay for somebody else's stuff. So I guess Australia is different in that sense, but it's not better at the end of the day because it's just another form of theft. So the money is just taken from everybody else to pay for those who would have been delinquent anyway. So it's a weird situation there as well. And I mean, every year, lo and behold, the Medicare costs and the amount that you get taxed for Medicare goes up and up and up and up, and it's going to continue until the system bankrupts itself. But my guess would be that because of the Frankenstein situation in the US, there's a lot more people that get caught, in a uglier situation in the US because of how it's structured there.
Yeah, I think what you're describing would be more of a single payer system here in the United States. And I think that, that would add more transparency to what you're actually paying for. There's a surgical center in Oklahoma that says that they will give you exactly what it's going to cost to get your total knee done or your gallbladder, and that they'll give you the cost. And if you find that it's lower than whatever you're going to pay in your local place, you can take a flight down there and have your surgery. They're quite popular, and they're gaining a lot of traction, at least on the folks I follow on Twitter for these types of economic issues within healthcare in the United States. It'll be interesting to see if they survive or if they're regulated into oblivion.
Yeah. See, that's the biggest problem. So from my understanding about the even the private health sector in the US is that they get slapped with so much fucking regulatory overhead, so much bullshit that they need to deal with, that they actually can't run a functional, profitable business. Because when you think about it, like when bureaucrats and government get the fuck out of the way of a business's ability to provide a good or a product or a service, the cost naturally goes down. It's simple because people then can compete, and they don't have the excess overhead that is largely just administrative and fucking bullshit just to make some bureaucrat happy or validate some bureaucrat's existence. So then what does that end up doing? That cost then flows down to the customer, and the customer's like, this is really, it's too expensive. When in reality, 20, 30, 40, 50% of that cost is actually administrative in nature that then flows to the bureaucrat, who is actually adding no value to the to this medical product and service supply chain. It's such a fucking scam, and that's what really pisses me off about it.
Well,
if I could, sorry, Tom. If I could, I think this might be a good time to bring up my second point, which is trade-offs. And I may have a unique perspective on this because although I'm originally from the US and living in the US, I actually studied and trained in the UK, so I'm very familiar with the NHS system. So having experienced both systems, I think it's fair to say that they both have their strengths and their weaknesses. And for some reason, when we like to talk about socialized medicine and single payer in the US, we never talk about the trade-offs, ever. It's always about the benefits. And I think this is true of anything. Anytime any topic gets covered, whether it's, COVID or, the stimulus packages, it's always the benefit and never the trade-off. And I think this is a type of fallacy that just leads you down these dark rabbit holes, because you come out on the other side and you have no idea what hit you. So, I'm not going to sit here and debate the trade-offs between, socialized medicine and a free market medicine. I think that's a topic for another day. But something I'd like to talk about in terms of trade-offs is the public health initiatives over the past year, um, I think it's the coverage and the public health has been shocking. I am flabbergasted at how poor the discussions have been around the topic. And I hesitate to blame public health officials, or let me rephrase that. I blame public health officials, but I hesitate to blame many doctors because I don't think the doctors who are in line with the way we think are the ones getting their opinions voiced.
Yeah.
So so take simple topics, whether it's masks or lockdowns. Um, it's so easy to just say, yeah, everyone should wear a mask. Okay, fine, and or everyone should lock down without talking about any of the trade-offs. And it's it's amazing to me that we've gone, what is it, 8 months since the UK brought in that initiative of 2 weeks to flatten the curve. It's been, I think, 8 months.
Yeah.
And no one,
Still haven't
We've
flattened it either.
we've flattened
Yeah.
everything fucking else. We've flattened people's lives, their moods, the supply. We've flattened the fucking economy. We've flattened everything.
That's right. That's right. And you can't discuss that because if you discuss all the negative consequences, then all you want to do is kill grandma, and that is your goal. You have no compassion, nothing. It's amazing. Anytime you try to bring up trade-offs, you get treated as if you are heartless and you don't care about people. Meanwhile, I'm sitting there thinking about, all the negative knock-on consequences of this, even the health-related consequences of this. Think of all the missed cancer appointments, all the misdiagnoses, all the people who have fallen into alcohol addiction or drug addiction, the overdose deaths, the suicide deaths,
Child abuse, domestic
child abuse, domestic abuse. It's as if these things cease to exist, as if they don't matter anymore, because all that matters is the counter that's on the side of CNN or MSNBC that's counting the number of deaths or cases. That's all that matters.
Yeah, we had patients who had ruptured aneurysms at home and refused to come in. We had people who had, acute limb ischemia, cold legs, arterial blockages, afraid to come in. And once they came in, it was so far advanced, they required, very high amputations. And it was very sad because these people were just scared. They were obviously just watching CNN all day and thought that if they walked out the door without a moon suit, that they'd get something that would, it'd be like a VX nerve gas attack or something. They thought. I don't.
And I'm not just shilling some conspiracy theories here. I have this article sitting in front of me. It's a peer-reviewed journal article from Stanford University that came out just last week. The title is Assessing Mandatory Stay-at-Home and Business Closure Effects on the Spread of COVID-19, if anyone wants to look it up. So just reading a couple sentences. So in the framework of this analysis, there is no evidence that more restrictive non-pharmaceutical interventions, aka lockdowns, contributed substantially to bending the curve of new cases in England, France, Germany, Iran, Italy, the Netherlands, Spain, or the United States. This is a Stanford peer-reviewed journal study. So to anyone that loves to talk about trusting the science, please show me your peer-reviewed study that exhibits that lockdowns are effective, and also they're effective when you take trade-offs into account. I haven't seen one. Masks are more debatable. If you want to debate masks, go ahead. I mean, if you want to wear a mask, you should have every right to wear a mask. I mean, you probably shouldn't have any right to tell me to wear a mask, but that's a whole different subject. But
No, John, you're right. You're so right on the trade-offs, because you look at the World Health Organization guidelines from 2014. There's no mention of lockdowns anywhere. All it is, isolation, PPE for the healthcare facility or the doctors and the nurses and all this. There's not one mention of, hey, we need to lock down an entire city. The reason they went with lockdown was because initially China did it. And as soon as China did it, everybody thought that was the way that you manage the coronavirus. You lock people in their apartments. And that was very sad that their behavior and their ability to, or inability to deal with the coronavirus spread then to every country in the world. And that we basically took all of the peer-reviewed information we had from the World Health Organization from that 2014 guideline, which I can send that to anyone if they want it. I read it today in preparation for this. And it's sad because a lot of that stuff was all, like you said, peer-reviewed, a lot of good studies, a lot of good science, and they just threw it out the window because China said we have to have a lockdown. And it's just amazing how many people fell for that. And they destroyed the economy.
And here's the thing. If we're talking about February and March, I understand. Everyone was worried. Everyone was scared. We had no idea what we were dealing with. I remember sitting in at meetings and just wondering, like, what is happening? Am I gonna have to, like, seriously consider talking to my family about completely isolating myself and potentially getting sick and potentially, putting my life on the line? But it didn't take very long for me to realize that that wasn't the case. And moreover, to be pushing for things like lockdowns 8 months into this is egregious. It's absolutely egregious.
It's
it goes
ridiculous.
against it just goes against it's inhumane. I don't know how else to put it. It's inhumane.
I think the one of the most abhorrent components on it is just the mandated nature of it.
Mhm.
Is that, again, like you kind of alluded with the mask thing, it's like I couldn't care less if someone wants to wear a mask. Like for me, that probably just tells me one of two things. One, that people like, that person is genuinely like afraid and overreacting and must be like that in fucking general life. So I kind of would prefer not to hang out with them. Or two, they could be genuinely immunocompromised, and that's fine. That's their right to do so. But the overreach by the state to mandate everybody, healthy or not, immune or not, had it or not, like all this sort of shit, I think is just fucking egregious overstep. Like I've been recently banned from 2 gyms because inside the fucking gym, they've been forcing me to wear a mask. Like, and I can't, like, this part I can't get through my head at all. Like, you go to the gym, you go to exercise for what? To oxygenate your body. But hey, let's put a mask on so that instead of oxygenating my body, I'm, carbon dioxifying myself, and basically suffocating. It's so like, and I tried to have a conversation with the person at the front desk. I'm like, the gym is about coming to get, healthy and get strong. And they're like, yeah. Why am I wearing a mask? Because you have to, it's for your health. But I'm like, but that's bad for your health to put a fucking mask on while you're trying to train and oxygenate. Yeah, but that's what the government said.
It can actually cause cardiac arrhythmias too.
Mm-hmm.
If you develop enough hypoxia while you're exercising, that can be fatal, even for a young, healthy person. So
absolutely.
I mean, I get what you're saying about, I mean, for me, I was wearing a mask a lot, I think, the idea that you're wearing it outside though made no sense to me. That's ridiculous.
Guys, we're seeing people wear masks in their cars alone.
Yes,
dude,
that's where the whole narrative has just derailed. And I got to blame Fauci and frankly the Surgeon General. They ruined the narrative from the very beginning because they gave us differing opinions. First, they said masks don't work, don't wear a mask, and that was it. That was during the surge in New York, and everyone's saying, well, then how do you stop it? And the answer was lock it all down. Then what was it 3 months later? Oh, everybody's got to wear a mask now. So then they were telling people to wear bandanas. So I have an African-American friend of mine who's a surgeon too. And I said, I guess we're going to have to wear masks. And he said, he's like, Tom, you don't understand. He says, if I walk into a gas station with a bandana, I'm going to get shot. He said, somebody with concealed carry is going to take me out. And I didn't understand what he was talking about at first, but then I started to realize that I was like, yeah, he's not messing around. If you know, they're going to tell everybody to wear these stupid bandanas. It's just so ridiculous to think that a bandana would prevent any kind of respiratory viral illness.
Yeah.
for
It's
for
so dumb.
a coronavirus. It's 0.12 microns in size. It's actually smaller than what an N95 can take care of. N95s is, you know, it can take care of anything 0.3 microns or greater. So it's actually smaller than what an N95 can even prevent if you get a direct blast. Now, the idea being that, yeah, it's going to be viral load, so it's going to prevent most of the droplets that could possibly get into your system and cause that problem. You know, it's a viral load issue, and that was another thing people weren't really taking into account either. And frankly, Fauci wasn't either. And for somebody who knows enough about it and was probably very familiar with the World Health Organization guidelines from 14, for him to say that masks don't matter at first and basically lie, so then the hospitals could acquire as many N95s as they could, was just beyond the pale for me. I just thought it was incredible that he got away with it. And
Well,
same goes to the Surgeon General. I mean, it was just complete malpractice on their part, frankly.
That's always the risk with centrally managed mandates. That's the thing. Like when we operate in a decentralized manner and people are able to choose the risk level themselves, that's completely different. So again, like tying the mask thing again is similar to lockdowns. If you are genuinely afraid of your own health, you think you're immunocompromised, fucking stay inside. I don't care. Like, but let the rest of us go out and, you know, live and do the things that we want to do. You know, and then again, if you think that you might need some sort of protection, you know, and you desperately want to go outside, go get an N95 mask on, or put on a fucking helmet, or do whatever you want to do to protect yourself. But that is your prerogative. Like, and this, I think, this idea of we are all in this together, I think that's one of the biggest fucking scams that's been perpetuated in society, because we're not in anything together. We're individuals.
It makes no sense, and it's so untrue the way that they've responded to it.
Correct, because like, furthermore, like, I cannot be responsible for somebody else's thing, because if we take that line of thought, then I should be going around and saying, well, look, cars are fucking dangerous because I could get hit in the car. So you should not be able to drive a car. And guess what? You should also not be able to walk on the street, because, you know, women, should not be able to walk on the street because they're, you know, they have a high degree of getting raped if they're walking on the street in somewhere dangerous. So we should ban all women from walking on the street. We should also ban fucking Tinder, because, you know, there's been people that have been, you know, kidnapped or some shit has happened on Tinder. So we should ban that, because that's also dangerous. We should also ban God knows what else. Smoking.
It should be safety. It should be safety at all times, in all situations. Everyone's comfortable. No, there's no struggling. You'll just have the perfect life, right?
That line of logic just does not work. So the only
you'll own nothing
here,
and you'll be happy, right?
Correct. And it's such a deranged form of thinking, and this is why mandates never ever work. It just has the it's the Cobra effect, right? Like, if you guys are familiar with it, like what the dumbass English tried to do in India, like there was. So for the listeners, if they're not familiar with the Cobra effect, it was that, you know, there was too many cobras in the city. And they came up with their brilliant idea of let's incentivize people to kill the cobras. So they paid people whatever it was, 10 pence or something like that for each cobra head. So what people went out and did was they started breeding cobras so that they could get more money. And then when they tacked onto that, they're like, oh crap, this is a bad idea. So then they canceled the incentive, and then they ended up all the cobras that everyone was breeding, they just let them out in the street. So they had 10 times more than they had in the first place. That's exactly what these fucking mandates are doing. You know, they're giving people false, you know, sense of safety. Like, you know, one of the ones that I really love is, you know, they've got people standing 1.5 meters apart in the airport, you know, wearing their masks. And then everyone gets on the fucking flight and sits next to each other. It's like, what the fuck?
They're packed in like sardines.
Yeah, it's so hypocritical. Like, or like what I saw earlier today. Sorry, John. The last one I'll mention here is at the inauguration of Biden. I was just cracking up. There's you've got these guys there. They're playing whatever the flutes or the instrument that they're playing. So they walk up with a mask, and then they take the mask off and they start blowing through the instrument. It's like, wait a minute. is this a sitcom? Like, is this a comedy or is this for real? Like, and it's for real.
It's virtue signaling is what it is.
Ew.
I mean,
look,
the images I've seen have been so bizarre. People at concerts playing wind instruments with masks with holes in them, as if,
yes,
you know, oh, well, that, you know, COVID saw the mask, saw you were trying, so you know what? It walked right on by, didn't care.
and left
Or
you
things
alone.
like, you know, it's amazing. You'll see politicians put curfews, like, you know, bars can be open, but only until 10 p.m. or 11 p.m. And they don't realize that what they're doing is they're making sure that everyone leaves at the same time and congregates. That's
At the same
exactly
time,
what
yeah,
they're
exactly.
doing. And it's like,
Perversion.
it's amazing that they can't think one step ahead, just one step. And these are the people that we entrust with everything, our entire, you know, system of governance. It's just shocking to me. But, you know, just going back to a couple things. So the second point I brought up, you know, trade-offs. We discussed a lot of the trade-offs of these decisions that are made. You know, you can apply it to anything, whether it's lockdowns or masks. You know, we talked about, you know, potential for cardiac arrhythmias. You know, you could talk about respiratory deficiencies, and you can talk about the differences in masks. Everyone likes to pretend that for some reason all masks are the same. You could just wear, you know, a plain old cloth mask, or you can wear a bandana, or you can wear an N95, and they're all the same, and that's just not true. And then the third point I wanted to touch on, which you guys, you know, started discussing in detail, was autonomy. And something that's, I think, completely dismissed now, is in medical school. One of the things that you learn early on is the importance of patient autonomy. And you have the knowledge, you should be able to convey the knowledge as best you can to the patient. But at the end of the day, the patient has the choice to do what they'd like with their body and their life. And no matter how much you think the patient is making the wrong decision, it's not your life and it's not your choice. Now, if you expand that out to everything we've seen in the last year, it's shocking to me how the idea of autonomy and independence has been completely thrown out the window. Whether it's, you know, mask mandates or lockdowns, the speed at which your ability to choose has been taken away is jarring. It really is. And it's happened on a global scale with very few exceptions. And what's even more worrying to me is the fact that people are not responding the way I would like them to respond. I thought people would be much more upset much earlier. And perhaps that was naive of me.
Man, that's been actually one of my biggest disappointments.
Yep. Yeah, I think it was maybe naive of me because, you know, I'm surrounded by Bitcoiners and by people who are very similar to me in my real life as well. So it didn't take me very long to flip the switch from, oh, I'm not sure what I'm dealing with, I'm worried, I don't know what the consequences are going to be, to this is ridiculous. Like, you cannot take away people's rights to, you know, move freely outside their homes, or you know, travel on public transportation and do all these different things that is just part of everyday life, or congregate in groups of 5 or 6 or more, or host private parties, or just simple things, you know. And
yeah,
I have to say that is probably one of the most worrying things to me, is not just the actual actions by governments in terms of mandates and lockdowns, is the lack of response by the people.
it's such a mixture of both. Like, because it's What I think one of the things that drives me crazy is this is yeah, like for me, I'm super disappointed by people in general. Like so it's
Hmm.
I've said that, you know, we live in this sadomasochistic world where you know, your neighbor wants the worst for you. You know, so they want you to fucking you know, have no job, have no business, stay home and be depressed. And they
Hmm.
somehow are begging the government to do more of that to them. So it's like, it's really weird. It's like a sadomasochistic episode of the Twilight Zone where, you know, give me more fucking oppression and please oppress my neighbor as well. So it's like, it's really sick in that sense. Like I find that bad. But then also like, you know, the government, like as much as we're guilty, like they are so guilty as well, because
Hmm.
some of the things we've seen, like, is they will beat you into submission for your safety. Like it's like, we're gonna come into your house, we're gonna beat the shit out of you, we're gonna drag you out, throw you into jail because we want you to be safe. And
Because there's
that to
no
me is
corona.
like,
Yeah, because there's no coronavirus in the jails.
oh
See?
yeah. There's that funny meme which is you know, if you're in jail, we're gonna let you out because of coronavirus. If you party, we're gonna throw you in jail because of coronavirus. It's like, which fucking one is it?
And what
But
I
you're
find
right,
so
man. The
ridiculous.
autonomy. Go on, Tom.
So the thing that's so ridiculous is the prison systems are some of the highest, you know, breakout or hot zones of COVID there is. It's all in enclosed spaces where you have no ventilation, and there's a lot of people in one place. And you know, so they're incarcerating all these people. You know, there was a place I heard about recently. You know, 700 of the 1,000 inmates all had COVID. You know, and they're transferring them all to the local hospitals, and you know, then it further overloads the hospitals who are trying to deal with their community. And you know, I agree. It's just, you know, all these, you know, the lockdowns and then the authoritarian, draconian ways they're dealing with it just were not well thought out. And I think a lot of unintended consequences, like you said, John.
Well, that's the thing. Like you can never. The problem is even if they were well thought out, a mandate doesn't work again because number one, it's impossible to get everybody to do everything the same. Like we are human beings. So number one, so if we start from that premise, no matter how well thought out it is, no matter how well it's planned, it is not going to go to plan. Like, you know, there's that classic saying is if you want to make God laugh, tell him your plan. So first of all, we know it's going to fucking fail. Like, I mean, I even know people who genuinely, like, I was in Europe a lot of this year, and you know, people were in the beginning freaked out, and even people who I was hanging around with was, you know, they were shit scared of COVID, but guess what they were doing? They were all under the fucking radar, going and catching up and doing little house parties themselves. Anyway, even though they were fully fucking believing in Corona and COVID, and they were wearing masks like fucking religious maniacs. But then they would go on a Friday night on a fucking bender at their friend's place with cocaine and this and that. And they just fucking go nuts. And I'm sitting there watching. I'm like, weren't you just fucking abusing me for going outside to the park for having a fucking run and telling me to put my mask on? But now you're going to, oh yeah, but that's right. It's only us. It's like, so the hypocrisy is fucking crazy. But let me take a step back there. It's not about the hypocrisy. It's about the fact that none of these mandates were ever going to work anyway. Like you would have to make the assumption that everybody on the planet was going to wear a fucking viral, you know, virally protected N95 or two N95 masks at the same time at all times when we're fucking eating, drinking, sleeping, all that sort of shit to make sure that this doesn't spread. And then let's say COVID stopped in its tracks like that. And then 2 weeks later, guess what? We have the next problem is we go back to normal and the shit appears again. And we are perpetually again under the next fucking draconian mandate. So it never, ever, 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 ever works, no matter what they try and do. So if we know that, why the fuck are we doing it? And this is part of the thing that makes me crazy about this whole situation.
Well, I mean, this is the problem, right? I mean, you try to apply logic to the decisions, and you'll never find an answer because there is no logic there. You don't know the incentives for some of these decisions. And you know what? Honestly, I think a lot of it is fear, and a lot of it is the fear of consequences specifically. So if you're, say, a governor or a some type of public health expert, if you're the one that stands against the crowd and says, you know what, I don't think lockdowns are effective. Data shows they're not effective. I don't think we should lock down. Look at all the negative consequences and the trade-offs. And your state or city decides not to lock down and you have a certain amount of COVID deaths, those deaths will be blamed on you. And the way the media works is they will just bombard you. Even if it's not true, if it fits an agenda, they will use you as an example. So if you look at the US, for example, the US is a great little experiment in general because you have these 50 states and they have their own set of state laws, and then there are federal laws on top of them. So when it comes to something like COVID, you had a lot of different responses. You had some states that decided to go full on lockdown, post apocalyptic, New York City style, just decimating the entire city. And then you had some states that did half measures. Maybe they did lockdowns for a little while, or maybe they decided to, go in and out of lockdowns and or do mask mandates and then take away mask mandates and so on and so forth. And then you had states, very few, that didn't do anything, like South Dakota. Now, people will argue that South Dakota is not comparable to New York City and Los Angeles, and I understand the argument. But you have to look at the overall rates of both infection and mortality and excess deaths and compare it with the trade-offs. And if you look at somewhere like, South Dakota or Florida, which has mostly stayed open, and you compare their mortality rates, they're very comparable. I mean, I think they're both lower per capita than, say, New York or Massachusetts or Los Angeles. But even if they were slightly more, slightly less, look at the trade-offs. I mean, have you seen the pictures of New York City? That's New York City. That's the,
I know,
entertainment capital of the world. That's one of the hubs of American life, and it's just completely decimated. It's a ghost town.
It's
You have
that example extends everywhere, man. Like
Yeah.
Australia was the same. Brisbane barely had a fucking lockdown. Everything was fine. No one's sick. Melbourne had one of the strongest lockdowns in the world, curfews and the whole fucking lot. They had 100 times the issue that Brisbane had. So there's no fucking correlation between any of this stuff. Like, so like my argument before, which I forgot to actually make my final point about, like the fact that mandates are never going to work anyway. The fact that all of these plans will still fall apart because people will just do what they want to do, whether they're sort of more on the rebellious side like me, so I just will not fucking conform. But even if they're people who will conform, those guys still break the fucking rules anyway. So it doesn't matter. So basically, 90% of people will break the rules. So none of these mandates are going to work. What that means is that the only approach for any pandemic in any like future or past is to let people decide at the local level. And that local level starts with you as an individual, assuming, and this ties into your point, I think, which is the idea of autonomy. You take the decision upon yourself to figure out how cautious you want to be with this thing. If you know you've got some issues, be more careful. If you're fine, if you're not immunocompromised, if you're feeling healthy, if you're a young, strong person. I mean, the statistics are fucking out now anyway. We know that if you're young, healthy, and, between like less than even 50 years old, man, you're fine. Like the chances of you having a severe issue with this are so fucking low, it's not even funny. It's like, we need to allow people to have that autonomy and not beat them into submission when they want to have it. And that's where I think, like, that's what disappoints me most about the last 12 months. It's like, what happened to being fucking human? Like, we're no longer humans. We're just indentured serfs that are too incompetent to apparently think for ourselves. So we just get the shit kicked out of us when we want to be individuals who want to decide what to do with our own life.
So what is the way out of this is what I like to think about sometimes.
The way out of this is just to get the fuck out of the way and let people decide for themselves. I actually think that, I mean, there was a lady, Dolores Cahill, and she's a biochemist / something, and I watched the video with her, which of course YouTube deleted and banned. But what she argued was that, and you guys correct me if I'm wrong here, if I've got some of these numbers wrong. I'm just going to be paraphrasing some things. But in her discussion, she was like, the coronavirus is part of the broader, respiratory illness family, which we could categorize as flus really broadly. And a large percentage of those respiratory illnesses are part of the corona family. And we've had multiple of them over the last couple of decades. Now, they spread through because, like, what she kind of discussed, and I don't remember if it was her that discussed this or if I was, because I was reading just some like basic tenets or principles of virology, and what I came across was this idea of, and you guys, again, correct me if I'm wrong here, if I'm saying anything out of the ordinary, but severity is inversely proportional to virality. So in other words, the less severe something is, the quicker it spreads through society, because most people aren't really affected by it. So, we naturally just hang out with people, blah, blah, blah. And that's why something like the cold, for example, has higher virality, but lower severity. Whereas the flu, it's got a higher severity, but a lower virality, because when you're sick, it fucking hits you. So you stay home, you stay away from other people, you naturally, distance yourself from others because you don't want to, be contagious and all that sort of stuff. And you have a lower spread of something like that. So it's got a lower R0 value. So corona itself was apparently somewhere in between, or at least this strain, of corona, because we've had multiple, was somewhere in between, but it had quite a high viral coefficient. So her argument was that this thing spread in March, April, May really fucking quickly. Most people around the world got it. Most people didn't even know they had it. They were, they might have, unnecessarily sort of been sick. In fact, she said it probably would have started spreading in December, because there was a lot of cases of people just unnaturally or uncommonly getting sick earlier than they may have compared with other flu seasons. But it wasn't until the media engine came in and fucking propagandized the shit out of it that we actually started to overreact and freak out about this thing. Whereas I think the approach for any so-called viral breakout is to do exactly what we've done for the last 10,000 years, which is continue on with our lives, let it sweep through society. That may sound cold, but I mean, people who are naturally immunocompromised, who are immunocompromised, who are obese, who are overweight, all that sort of stuff, they're a ticking time bomb anyway. So if we have to shut down society for those people every single fucking time some sort of respiratory virus comes in, which is guaranteed to come every single year, we may as well blow the fucking world up now, because we're never going to get to live a normal life. But, so I think it's let everything open, let everyone live the life they want to live, and let those who think they are compromised or at risk take precautions themselves, but in no way mandate others to take precautions who do not want to nor need to. And that's kind of, so there's probably a couple threads that you guys can pull on there, but I'd love to hear the feedback, on the virality versus severity, I guess, mental model, which is, how they're inversely proportional. So I'll throw it over to whoever wants to pick that up.
So, when you look at the R naught values and all this, and the R naught of SARS-2 or COVID-19, it's roughly it's about 3. So it's about the same as SARS-1. In ordinary influenza, it's about 0.9 to 2.1. So your chances of getting this, it's much higher. And there's also, I think the other thing that I think caused so much confusion with this whole thing is the idea that you could actually transmit it being asymptomatic. There is an incubation period, and there is a mismatch, between the latency of when you're not infectious and when you are, and then when you're showing symptoms. That should have been explained a little bit in more detail, I think, by people like Fauci and the Surgeon General, because then you can protect the vulnerable. Like you said, I think there is a way to do this without shutting down the local gym, so that the younger people like yourself can get their exercise effectively without sitting in their apartment or their condo or their house or whatever it is and gaining 25 pounds in the last 8 months. I mean, I've talked to a lot of patients who said, yeah, I gained 30 pounds in the last 8 months because I haven't been anywhere. I'm not going to the gym. I'm not going to the YMCA. And, there is a way to do this so that we can protect, say, the prisoners at these prison systems. We can protect, say, the nursing home. We can, the people who work at those places, yes, they're going to have to wear an N95 and face shields, while they're taking care of those patients. They can't wear a bandana, if you're working at the local prison. That's not going to cut it, right? This thing spreads indoors with poor ventilation, where people are congregated in very closed spaces. There's no doubt about it. But I get your point. Is that are we going to let our entire economy just go down because of a respiratory viral illness that likely 90% of people under the age of 40 are going to bounce back from in 48 hours? These are the types of things that I think nobody could have foreseen this. But if you look at the history of pandemics, a lot of these similar things happen in the reactions to people, and the sociological reactions that we've seen have happened before. So if you look at, say, the Spanish flu and that, the reason they call it the Spanish flu is because Spain was the only country in the world that was actually reporting the deaths appropriately. Everyone else was lying to either make themselves look better or deny the problem. So
it was that, but they were also not involved in the war, I think. So it was, it was there was a couple of things that are interesting about the Spanish flu. But anyway, continue on that thread.
And the place where I really started to get interested in our reactions to it were this book I read called Apollo Zero by this guy named Nicholas Christakis. He's a doc out of, I think, Yale, but he's a sociologist, and he's, I think, in infectious disease. But he starts out the book of this a girl who, when she was 7 years old, got the Spanish flu, survived, and then once she was 107, she got SARS-CoV-2 or COVID, and survived that one as well into her hundreds. So it goes all through the R naught values and our reactions to it, and really the different countries and the way that we responded. A lot of this has been, we saw in SARS-1, we've seen the Middle Eastern virus, and in some of those, this was much more. The R naught value was much higher, and the people who were vulnerable were affected to a much greater degree. But I think there was a lot of failures to go around. But I guess my point is, what are we going to do I guess, moving forward as, say, libertarians and people who can communicate these issues to our friends and families, is to, hey, look, you can get out. You don't have to, stay in your apartment all the time. You don't have to wear a mask in your car. Just these basic common sense things, I think, are still being lost and are not talked about. Especially like you were saying at the gym, this gym is making you wear a mask indoors. Well, do they know that if you're wearing an N95 while you're exercising, there's a pretty good chance you're going to be hypoxic? you can have cardiac arrest right there. I mean, I think there's just so much common sense that people who are of an age that are not vulnerable to COVID and the severe effects of it are just, they're either scared out of their mind or they're willing to accept some of these lockdown measures.
I mean, that at a bare minimum, like I again err towards like complete, just get out of the way, stop talking about it. People are naturally going to be sick. They're always going to be sick. And in fact, like, I'm going to, apologies for anyone who's going to be butthurt at this one, but, I'm going to say it as, as objectively as I can, and it's going to sound harsh, but the consequence of not having taken care of your health and your immune system is that you may be at fucking risk, but there comes a time to pay the piper. And like, if Corona's done anything, if COVID's done anything, it's actually exposed how unhealthy and immunocompromised the entire fucking world is at large, because of the stupidity we eat, the way we fucking live, the massive levels of blind stress we put ourselves through in this process. And again, it's whilst we are to blame, a lot of it is manufactured primarily through this whole this monetary Ponzi scheme that we live in, because we're all, again, I just love the saying of we've got more month at the end of the money. People want to have more money at the end of the month, but they've actually got the fucking opposite, because we're all running this treadmill. And now, like, anyone who had the opportunity to actually, potentially get off the treadmill just had their fucking legs chopped off by the state, saying that, no, you can't run your business, you can't fucking have a job, you can't do this, you can't do that. And like, that is just like, I mean, I know so many people who would just say, look, I'd rather have this fucking thing and be sick for a week or two, but let me run my goddamn business, because I've got a family to feed. I've got, I've got kids to look after. I've got, I've spent my entire fucking life savings building this restaurant, and now it's being shut down because you won't let me take, like what John was saying earlier about like autonomy. You won't give me any autonomy to go and just get fucking sick and then open up, and then the only patrons that are going to come to me are the people who are willing to also get sick. But it's just like, it's so fucking mind-boggling. So we cannot, like, the dangers of setting this kind of a precedent is that every single time a so-called pandemic is going to come in, the media is going to fucking hype it up. There'll be his blind hysteria, and we'll be in this perpetual lockdown slash pumped with vaccine shit that we don't need, slash becoming ever more dependent on the government. Because, dude, Main Street, like the real economy has been absolutely decimated, whilst all the extra money printing has just driven Wall Street up, which has torn apart society even further. And what's that going to do? It's going to create a complete dependency on the government from everyone else. And what we're doing is we're growing a generation of basically sludge humans who have who don't even have the incentive to do anything for their lives, because why the fuck would you go out, save all your life, invest in developing a business, when the state tomorrow can turn around and shut you down because of a respiratory virus that's going around? Like, it deforms everything. And I just think that's
the problem with universal basic income. There's a lot of people saying, oh, well, because of COVID and the economic problems that we see now, we're going to have to pay people to stay home, or but then how will the people who run a business actually find anyone to hire if everyone's getting a government check twice a month? There's no incentive to go and work. And
correct.
I don't know what it looks like in Australia as far as the number of morbidly obese people that you see, but here in America, we're bordering on crisis levels. I've noticed
we've passed crisis levels, Tom.
We are past. I mean, all you have to do is go to your local Walmart, Meijer, wherever you go grocery shopping, and look at the people in front of you. Go into the line. Don't use the self-checkout. Actually go in the line and see what they're buying. If you look and you see what they're buying in their grocery bag and all that, it's staggering what they eat and what they drink. It's just
Well,
all this processed bullshit.
we should be
Corn syrup. You know, and here's the thing that gets me is the patient exam tables and beds and the chairs that we have in our office, they have increased exponentially over the last 10 years. I remember my dad came in to see my office, and he walked in, he just started laughing. He said, "Who the hell would need a chair like this?" And I said, "Dad, have you been to the local grocery store? Look around." I said, "That's who needs these chairs." I mean, we were literally, the food is killing us. It is making, they think a third of the population here in this country is going to be diabetic in the next 5 years. A third. So you have 30% of the US population is going to be diabetic. Do you know how many kidneys are going to die? How many people are going to need dialysis? How many people are going to have amputations for toes that are gangrenous? You know, you name it, blindness, all the other complications that we're going to see. Now, you mean to tell me you think that the inflation and the rate that healthcare is currently going up will be able to take care of all of this? It won't even be able to sustain the baby boomer generation. We're already seeing the cracks in the healthcare system from coronavirus, which there were some areas hit harder than others, obviously. But I think the reason California is getting hit so hard right now is their healthcare was so poor to begin with. You know, you had all these, you know, the number of people going into nursing school is down, so they don't have enough nurses. They're constantly increasing the number of patients that the nurses have to take care of in the ICU anyways. So then you increase maybe 20%, 25% to what they're usually used to, and then they're completely overwhelmed. And that's what I think they're seeing in Orange County right now.
If they're overwhelmed now, like another year or two of people staying at home out of the sun, watching Netflix and eating fucking fast food, wait till that, you know, 30, 40% of people that were obese turns into 60, 70%. Everyone will fucking die from the next respiratory illness because it's impossible to completely immunocompromise everyone and then expect them to survive the next natural virus that's going to spread through society. Like, in fact, this is going to sound really dark, but, you know, take it with a pinch of salt. You know, all systems naturally correct themselves. As a species, we have made ourselves sick, unhealthy, immunocompromised, and metabolically deranged or deformed. That in some ways, you know, something like this was bound to happen. Like, we built so much fragility into the anthroposphere as a system, like, you know, human beings as a system, as a collective system. This is a corrective thing, and instead of us allowing it to naturally correct, we are going to cause 10 times the amount of problem. We are literally doing a mass scale Cobra effect here, and I can't see a pretty way out of this whilst government stays in between. And in fact, I mean, again, this is also going to sound dark, but my guess is that there is enough incentive, like coming back to John's first point about incentives, is there is enough incentives here to manufacture hysteria for every single respiratory disease that emerges in the coming years, to keep pumping out fucking vaccines so that we pay for them. And you're going to see, like, I mean, people thought that Apple and tech companies were profitable. Wait till you see what the drug companies and the pharmaceuticals that have a monopoly on producing vaccines we never needed are going to, you know, how much money they're going to make, when we're literally, not only we are going to pay for these things, but our future generations are going to have to pay for all of this stuff. Man, this is so fucking messy. And the fact that we've slipped down this side of the slippery slide, it does not look pretty. The only way is to fucking chop the slippery slide and just fucking fall off the damn edge, and get every centrally planned mandate out of the way and let people decide for themselves as an individual and at a local level. The only way any of this functions. That there is no other solution.
I think it's going to happen in our lifetime. I think that the problem is that the federal governments all over the world have rang up these enormous debts compared to the GDP. And eventually, you know, the bills are going to come due to pay the interest on those bonds and that debt. and that's just not currently sustainable for healthcare from what I can see. So I don't know what the next 10 years will bring, but I think like you said, it's going to be very messy.
John, you had 4 points in total. So we went with incentives, we did trade-offs, we did autonomy. What was that last one?
So the last point I wanted to bring up is meaning.
Mm-hmm.
And I think this is very poignant for what we're dealing with today as a society, but also what we discussed today in this podcast. And you you have to look at all the decisions that were made and think about human beings and their purpose in life. And when you take away someone's livelihood, their job, when you take away their ability to be with their friends and their family, you take away their ability to experience all sorts of things, whether it's, travel or gatherings or just, having a beer with a friend. You're taking away their purpose. You're taking away their meaning. You're essentially taking away what makes them human. And I know some people may think that's a little dramatic and over the top, but you brought up Viktor Frankl before,
Mm-hmm. Mm-hmm.
and Man's Search for Meaning is one of my favorite books.
It is a powerful book.
And that's a book I read at a very dark point in my life when I felt like I didn't really have any meaning or purpose. And there's something that always stuck with me. And it was just this one line, and all it was those who have a why to live can bear with almost anyhow.
Mm-hmm.
And I think when you take away people's purpose, you take away their incentive to live, their incentive to fight, their incentive to grow. And I think that's what people are going to have to try to rediscover in the next few months and years.
Mm-hmm.
And hopefully, the one positive, the one silver lining that comes from all of this is self reflection and action. I I'm cautiously optimistic. I think
Mm-hmm.
Bitcoin has a role to play in this in the grand scheme of things, but at the end of the day, I think it comes down to individuals. And individuals have to make the choices to better their lives and better the lives of their families and their communities and eventually their society. But it starts at the individual level.
Mm-hmm.
Yeah,
Mate,
I mean,
that's
you have to want to do it. No
Mhm.
one's going to force you. And you can lead a horse to water, you can't make him drink. That's that old saying. It's so applicable to this. You're so right, John.
I think the meaning thing is so profound. Like it's like you said, like removing people's raison d'etre, like their why, their reason for existence. I think that is probably one of the most dangerous side effects of what's happening today. And I mean, like, we have not seen so much unrest in the world. I think, at least not since I've been alive. Like, I mean, granted, there may have been more in prior generations, but I mean, everything is a fucking problem now. Like, people are just restless. Like, they're empty inside because, their very ability to decide, to be the masters of their own lives has been stripped from them, let alone, the more basic things like hanging out with friends, like you said, having a beer, or your fucking career, your work. Like, the people I genuinely actually feel more sorry for is the people who've, like, the restaurant business owners and things like that have just absolutely had their entire lives decimated. Like, particularly, like, because I ran a hospitality chain of cafes and things like that when I was in my mid 20s, and that was like, I mean, I hate hospitality. I'll never go back to it as an individual. Like, I fuck it. It's such
You
a
shouldn't go.
rough
You should
business,
never go
right?
into. You should never go into medicine because it's just hospitality with more responsibility.
Oh, dude, it's okay. Noted, noted. I'll never do that. But hospitality, it's like, you've got to deal with staff, with hangry customers, with stupid suppliers, with dumb landlords, with fucking stupid banks and merchants. Like, you got all this shit just to make this like small sliver of a fucking profit at the end of the week, and you literally kill yourself working. And like, I could not even imagine. Like, I've been lucky. Like, I actually haven't been affected that much by this whole fucking lockdown situation, because I run a technology business, and being I guess blessed and lucky enough to have come across Bitcoin, I run a Bitcoin technology business, which is doing better and better as things get worse and worse. So I'm actually in a lucky position. So I'm not complaining because, oh, look at me, I'm oppressed and my life's bad. I'm actually genuinely empathic, and I feel fucking heartbroken for the millions of people out there who have had their livelihoods like decimated. And like I said, I have a particular soft spot for entrepreneurs who have been in the industries that have literally had their fucking livelihoods cut from them. They've been absolutely gutted, and it's like that like, if there was ever crimes against humanity, like that is the definition of crimes against humanity. It's like your fucking livelihood, what you've worked for all your life, has just been torn from you, and you have no choice in the matter. Like, you may as well just fucking line them up and shoot them, like, because what's going to happen with these people? So that they're all gonna, like, I personally would never have the confidence to run another fucking hospitality business after this shit. Not a chance in hell would I ever do that. So what happens to someone who's just lost that meaning? Like, they've wanted to be a restaurateur all their lives, or they had this, they worked all their lives to be a chef, and now their fucking whole thing was decimated. No way they're going to go back to that. They're going to end up being a fucking alcoholic, a drunk, a drug addict, or some shit like that.
This is why the suicide rate is so high. This is why
absolutely,
the number of admissions for alcohol, intoxication, drug problems is through the roof, as well as and much more so than the COVID issue. And I think of that guy in New Jersey who has his gym, and all he wanted to do was to run a business. And it's a bunch of younger people who lift weights all day, and they're willing to pay a monthly fee. And then the government came in and boarded it up, and then him and his buddies kicked the wood in and decided they were going to operate anyways. Well, then they seized his bank account, and I think they took $140,000 or something. So now he can't pay his legal fees. And how many times has that happened during the last 8 months? It's so frustrating.
It is really, really, really bad. So I think that the meaning thing really ties that off nicely. Thank you for framing that up, John, because I think, like, I'll throw another anecdotal thing in there from a trade-off perspective. It's really funny to watch, like, all the environmentalists and like how hypocritical they've also become. It's like, oh yeah, the environment's really important and this is helping heal. I was looking at some statistics a couple months ago that just in Bali alone, which is down in tourism by 85%, but just in Bali alone, which is a small little fucking island, 6.7 million disposable masks are thrown away per month. So if you abstract that across the entire planet, man, there is tens of billions of disposable masks, gloves, sanitizing, and shit that is decimating the environment right now. And people are like, oh yeah. So it's like we've like, for all the SJW social justice warriors out there who are like, oh yeah, humans are a plague on the planet. Now they're sitting there saying, oh, we must protect ourselves at all costs with disposable masks and all this shit. And oh, well, fuck the environment. It doesn't matter. Like, we'll just throw 30-40 billion masks per month into the fucking oceans and into the dumpsters that won't biodegrade for another 1,000 years. But that's okay, because we must survive this. And then oh, but you're driving a car, you're killing fucking the planet, you piece of shit. You should be shot. So it's like the cognitive dissonance for me is just like, I mean, I don't know. I sound angry, but I'm like almost beyond angry. I'm like sort of.
You're dumbfounded.
I'm dumbfounded. That's it. Like, I don't even know what to say anymore, because like
Hmm.
there is no analysis on trade-offs here. There is no autonomy. You know, the incentives are completely skewed, and the very meaning in society is being fucking wrenched out to the point where people are just going to want to like become worthless goo that, you know, just sits at home all day, watches Netflix, eats fucking fast food, and gets their government check. Like, whoa, what a like fucking, you know, Huxley, and like it's like a blend of Huxley and Orwell.
Hmm.
Like literally, you know, I wrote the article on that, you know, utopia dystopias, and I was like, man, Huxley and Orwell were actually both right, because you know we've sort of ended up in some Frankenstein version of both their futures, and it's really fucking ugly.
You know, I think in 10 years we're going to look back and we're going to say that these social media platforms are just as destructive as cigarettes. I mean, for example, walk around and see people and how they interact. No one can have a normal conversation anymore at a bar.
Mm-hmm.
Everyone's looking at their phones, even entire families, you know, from the restaurants that are still open. You know, you'll see them and they're all just looking at the pad or the phone. Nobody's really interacting or engaging in any meaningful way. But what kind of long-term damage is that doing to these kids? Their product was just so addictive that it works on the same receptors in the brain that crack cocaine works on. So there's I don't think there's any doubt that this is going to have long-term ramifications to our culture and people's intelligence levels as well.
Intelligence levels, I think, are so low at the moment. I don't know how much lower they can go.
Yeah.
Don't test fate.
Shit. Yeah. I'll just shut up. I'll just shut up before I get asked to wear a mask while I'm sleeping.
Now, can I just say something? I think we've been talking for a few hours,
Mm-hmm.
and what I find very encouraging is we know that we are all interested in, Bitcoin and the ramifications of Bitcoin. And I think we've mentioned Bitcoin less than 10 times, maybe less than 5.
Mm-hmm.
And what's keeps me optimistic and gives me hope is that I actually see Bitcoiners as a huge force for good in all of this,
Yes.
because they're carrying this torch of liberty in a world that is just trying to put that fire out at every turn. So, we can talk about Bitcoin and all the great things that it does, but I'd also like to talk about Bitcoiners in general and, all the people that they inspire. And, I've been personally inspired by so many of these people. They've made me rethink. I mentioned the other day on Twitter, they've made me rethink the way I see things, trying to, look at things from first principles, trying to assess my arguments, trying to poke holes into them and trying to restructure them. And it's given me a much more positive outlook, both on myself and the future, because I think that the more people do that, the harder it is to just fall for all these fallacies, to just accept these perverse incentives, to not look at trade-offs, to not respect autonomy, and to not understand meaning.
Mm-hmm.
So I have hope. I may be a little naive, but I have hope.
Look, I mean, we are bullish on Bitcoiners, and I mean, if there's a segment or a subculture to be bullish on, it's those. I think, what one word I'll add to. So I actually agree with you. I think, whilst I'm pessimistic for the short term, I think
Mm-hmm.
it's going to get messier in the short term. For the medium to long term, I'm actually quite optimistic, because, as Bitcoin breaks the back of the state, the world naturally fragments again, because that's what we fundamentally need. Like, you cannot
Mm-hmm.
run the lives of people. You can't run any large scale complex system from the center. It just doesn't function like that, unless we want to turn ourselves into a macro version of North Korea. Like I always tell people, I'm like, if you don't want any crime, just go live in North Korea. You know what I mean? Like, where there's not a great crime rate there because everyone is fucking forced to, to conform, and you are all the fucking same. So there's your outcome of equality. It doesn't look very nice. So for me, like as Bitcoin breaks the back of the state, as it starts to break the large scale monopolies, and as that wealth transfer genuinely I guess from a monetary sense enriches people who I think value, like you said, liberty, but I would also throw the word like responsibility. I'm like in love with the word responsibility now, because like Francis said it really funny in the last podcast that I did with him. He's like, we're talking about like how much of the derangement syndrome we're seeing in the world today is due to like some sort of plan and conspiracy theory, and how much of it is due to what he liked to call, he said, ass covering and plausible deniability. And when he described it that way, I was like, dude, I was on a podcast the other week saying the biggest problem in the world is the renunciation of responsibility, because that's what we're doing. Like the existence of the state gives people the ability to renounce responsibility across multiple lines, like whether it's financial responsibility, whether it's like, so you make a bad decision, it gets fucking socialized. It's help your physical body's responsibility. You fuck up something, it gets socialized. So the more and more we move into a world where responsibility is renounced, we actually pervert just almost everything. Like we have this sort of this gray goo of moral relativism, whereas I like to think of Bitcoin as, and I wrote this in my recent article, it's the renaissance of responsibility. It actually literally goes counter to the direction that the world is flowing in at the moment. And I think that is the biggest cure. It's the ultimate antidote to the madness of modernity. And yeah, as I am also bullish on Bitcoiners. Like I said, I'm a little bit pessimistic in the short term because I think we're going to have fucking our work cut out for us. But these conversations, man, make me so like, they're just so encouraging, because it's people who are willing to think for themselves, to actually take responsibility for their ideas, their thoughts, their actions. And it's like, and whoever this reaches, like I hope that they then carry that torch to the next person and the next person, etc. Because that's how these mimetic movements start to shift. And yeah, I think this sort of mind virus, alongside just the natural collapse of the old, with the enriching of those of us who actually hold the hardest money in the world, we actually have a fighting chance to longer term fix this. I just really don't know what the next decade is going to look like. Well, I know what's going to happen. I just don't know how and when.
Yeah, that's a fair point. I think I'm actually in agreement with you. I think it does get better before it gets. I think it gets worse before it gets better. The question is how much worse, and for how long. Sometimes I don't know. It's an interesting thought exercise. I like to go through different time periods in history and think, what would have happened if they had Bitcoin? And there are so many incidents in history where I think, what, that war may have not happened, or may have been much shorter, or that atrocity maybe didn't happen because people could have escaped, and they could have escaped with their wealth, and they would have been they wouldn't have been trapped in one place, and all these different things. And then I bring it to the present, and with my knowledge of history, I can see where things are going, and I'm worried. I'm worried on a larger scale, because first of all, this time it's global. I mean, you're having, hundreds of fiat currencies collapsing at the same time on a global scale, while also having lockdowns on a global scale and a pandemic on a global scale. And you mix that in with a monetization event of something like Bitcoin, which is literally once in a human civilization event. And I have no idea what's going to happen. It's going to be extraordinary, whatever it is, because we've never experienced it before. But I'm positive about the future. The present, near term, who knows? All I can tell people is just make sure you have backup plans and backup plans for your backup plans.
Mm-hmm. Yeah.
I think being resilient and, the whole idea of Nassim Taleb and the anti-fragility is something that most of the Bitcoiners subscribe to. And I think if you can survive all this, you're going to get through it. And being able to think for yourself and questioning authority is something that is really part of the ethos of Bitcoin and a lot of the people I've met through it. So even if something catastrophic happened to Bitcoin and it failed, I think that people who are into it now with the same mindset would find a way to survive and to persevere. I don't think Bitcoin's going to fail, but I think that just the mindset and having the ability to think for yourself and question the authority and the government itself or wherever you live is something that will be valuable moving forward.
Very true. All right, gentlemen, we have smashed 2 hours here. I have to run because I've got to catch up with the team. So, is there any final thoughts that you guys both want to, have a moment to sort of comment on in entirety? I mean, I had a bunch of questions that I wanted to hit, but we're not gonna. There's nowhere near enough time. Like, we're probably gonna have to do a part 2. But maybe my last question was, how does Bitcoin fix this? Which we may have just answered. So, I'll throw it in both your courts for some final comments, and let's wrap this baby up.
Tom, you want to go first?
Sure. I'd say thanks for having us on, and get Amber, download the app, and start DCAing into Bitcoin right away. I think that's the best way to do this. At least for me, it's the lowest stress way to do it. And I think we're all going to make it. We're all going to make
Very
it.
optimistic. We're all going to make it. Where can people follow you, dude? What's your Twitter?
So Twitter's the best, at BTC DCA. I wrote a Medium article all about how I got into this and started dollar cost averaging into Bitcoin. And it's just a phenomenal way to do it. And so smarter people than I actually started an exchange like you did with Amber. So again, download it and start doing it right away.
Awesome, man. Awesome. Thank you, Tom, for being a part of this. I really appreciate it. So, John, over to you, buddy.
So I just want to thank you for having us on. I think this is actually my first podcast in the Bitcoin space, even though I've been around for a while. And the reason why I agreed to it is because I'm a big fan of your work. I'm also a big fan of the way you think. And I really appreciate the way you approach these conversations with an open mind, and you stay principled in your ideas. And I think that's something that's very valuable going forward, both for your podcast, but also the community in general. So thank you for that.
Thank you. That really means a lot, man. Thank you.
Yeah, and also, I hope people can listen to this conversation and think about, the big topics that we talked about, incentives, trade-offs, autonomy, and now I'm forgetting the last one, meaning, the most important one. So I hope people can look at those and see how it applies to their life on an individual level, but also at a societal level. So when they look at these topics in the media, whether it's, COVID or the response or, anything, they can apply these principles and they can make judgments for themselves rather than accepting the opinions of others that are fed to them. So I too am hopeful. I'm not gonna, you know, paint butterflies and rainbows over here, but I too am hopeful, and I hope we can do this again because this has been really fun for me.
Awesome, man. Awesome. Look, gents, it's been a pleasure to have you both on. I think we could have probably gone for another hour or two, but yeah, in the spirit of getting back to work, I'm sure you guys have some stuff to do. Let's wrap this up now. So thank you both. John, actually, quickly, where can people find you on Twitter? Because I know you've got quite a popular account.
So you can find me on Twitter at Dr. Bitcoin MD, and also I actually just published an article today in Bitcoin Magazine about the great migration to Mastodon. So if you're interested in joining a more tight-knit Bitcoin community, read that article. It's called The Great Migration, and read about how Bitcoiners are forming this community outside of Twitter on Mastodon. So if you want to check that out, I'm also on Mastodon, Dr. Bitcoin MD at bitcoinhackers.org.
Brilliant, brilliant. All right, gents. Thank you again. Enjoy what's left of your day. I think it's later where I am than where what it is for you guys. So yes, stay in touch, and hopefully we'll do one of these again in the coming months. In fact, it'll probably be really interesting to do one of these again in, like, you know, towards the end of the year, to see whether the world continued to devolve into stupidity, or whether there was some sort of bounce back. It's gonna be really interesting.
Yeah, looking forward to it. Thank you.
Yeah, thanks,
Yeah,
Ian.
thanks, guys.
Bye.